Okay, the question: do women after vaginal birth feel the desire to have sex? Well, the answer is 90% no, they do not. The reasons are clear, especially the first 1 to 3 weeks. The reasons are clear. One, the woman is still having some are still having stitches, maybe from episiotomy or from wounds that occurred during the birth process. So that's still healing. And also lost share, there's a fluid that comes out from the woman or discharge that come out from woman after birth. So there's some of them are still expressing that as first, second, and third week, even a month. So they are not yet okay. And after birth, the estrogen level drops, and that means that sexual desire will also gonna drop. So, and when we talk about emotions, how do they feel about that? They are much concerned about a baby. First 1 month, what they'll be much after or interested is, how is my baby doing? Am I doing the right thing to keep my baby? Is my baby safe with all this? So their mental health is much or the mental ideology is much shifted to the baby. So they don't really feel that much. But I think in a population of 100, 10% can still have desire because human body is different. But then majority do not actually have the desire for sex because of this soreness. The body is still healing, and the sense that if my baby is safe, is my baby actually safe? Am I doing the right thing to make sure that my baby is safe? So, but because the only thing that gives them the relief is when they go and say that their baby, it helps them to heal. So within that 1, 2, 3, 4 weeks, they don't actually feel sex. 90% of them. Then when their husband asks for sex within that period, it's it's usually a devastating request. Although some of them they have no option, but then right inside them they're not having that desire, because even some of them, because of the hormonal drop, the vagina is still dry, because of the drop in estrogen levels after birth and all of that. So 90% of them do not actually, I'm talking about vaginal birth, right? So 90% of them do not actually feel desire to have sex, and because of this shift in focus on the baby well-being, is my baby doing well, am I doing the right thing to keep my baby alive, and all of that. So, and compared to the process, because they're still recovering, they're still healing, some are still having the stitches from episiotomy or a torn vagina part, so they don't actually feel good about it when you ask them for sex, but some of them still give in because of they don't want to lose their marriage, so but then inside of them they don't enjoy it. I would say about 90% of them.